Hello friends, this is part 3 of Medicine Plus Pathology questions of Rajasthan Medical Officer exams, and these are PYQs which are taken from last 2013 to 2022 for the 8 years. So let's start with the first question in the part 3. So first question is the confirmatory test for the sickle cell disease is. So if we talk about option number A, then osmotic fragility test. Osmotic fragility test is most commonly used for the hereditary spherocytosis. Hemoglobin electrophoresis, this is true. It is a confirmatory test for sickle cell disease. Erythrocyte sedimentation ratio, ESR, is used for many inflammatory conditions. And hemoglobin estimation, no, this is not true. So answer will be option number B, hemoglobin electrophoresis. So next question is all are the acute phase reactants except. So if we talk about the acute phase reactant, then these are one is CRP, ferritin, fibrinogen, heptoglobin, hepcidin, procalcitonin, serum amyloid, etc. So these are some of the acute phase reactants. So if we talk about the option, then C reactive protein, this is true. Fibrinogen, this is again true. Serum ferritin is also a acute phase reactant, but serum bilirubin is not a acute phase reactant. So this is an incorrect option. Answer will be option number D. Serum bilirubin is not a acute phase reactant. Which of the following deficiency results in pan-acinar emphysema? So this is a direct question. We know that alpha-1 antitrypsin will lead to the pan-acinar emphysema. Answer will be option number A. So this is a repeated question. Type 1 diabetes mellitus is characterized by, so adult and obese. We know that in adults or obese, type 2 diabetes mellitus is there. Insulin resistance in the peripheral tissue. So insulin resistance is seen in type 2 circulating islet autoantibodies. So yes, this is present in type 1. Non-ketotic hyperosmolar coma. This is again a feature of type 2. In type 1, if we talk about, then ketoacidosis is there. So here answer will be option number C, that circulating islet autoantibodies are there, which will destroy the beta cells, lead to the decrease secretion of the insulin. Next question is in enteric fever, the organ lodging maximum number of organisms. So generally we think that in enteric fever mostly the small intestine is involved, but actually the organ which is lodging maximum number of the organism is, it is gallbladder. So answer will be gallbladder. Next question is metabolic acidosis is compensated by. So whenever there is metabolic acidosis, then the compensation is occurred by the respiratory alkalosis, which occur due to the increase in the ventilation leading to the washout of the carbon dioxide. So increased ventilation will lead to the increased CO2 washout, which will lead to respiratory alkalosis. So answer will be increased ventilation, option number A. Platelet count less than dash is one of the criteria for probable diagnosis of the dengue fever. So we know that in dengue fever, platelet count is less than normal, and normal count is 1.5 to 4.5 lakh. So less than 1.5 is one of the criteria for the dengue fever. So answer will be option number A, 1,50,000. Next question is dash is the long-term index of the glucose control. So blood glucose is generally used for the current level of the glucose. Glucose in urine, it is not used for that. Glycosylated hemoglobin is used for the long term or the at least it is used for the 3 to 6 months glucose control. Then serum cholesterol, it is a lipid profile test, so it is not used for the glucose control. So answer here will be option number C, glycosylated hemoglobin, which is HbA1c. A 63-year-old man has angina, syncope, and congestive heart failure. So angina and syncope are occurs when there is no proper supply of the blood to the body from the heart, and congestive heart failure is there. So most probable the patient is suffering from mitral stenosis. No, in mitral stenosis, angina and syncope is generally not there. Tricuspid regurgitation also do not have angina and syncope. In atrial stenosis, is characterized by the angina syncope, and it is of course a congestive heart failure. So this is true. And aortic regurgitation again do not have syncope. So answer will be option number C, aortic stenosis, which have all the features such as angina, syncope, congestive heart failure. Which of the following is the cause of the normal anion gap metabolic acidosis? So if we talk about the option, then cholera, yes, it is a normal anion gap metabolic acidosis. Starvation will lead to the decrease in the fluids in body, which will lead to the increase in the anion gap. So it is high anion gap metabolic acidosis. Ethylene glycol poisoning, of course this is also high anion gap metabolic acidosis. And lactic acidosis is again a high anion gap metabolic acidosis. So option number A, which is cholera, is a normal anion gap metabolic acidosis. Which of the following is correct about the type 2 respiratory failure? First option is low PO2 and low PCO2. So this is a feature of the type 1 respiratory failure. Option number B, low PCO2 and high PCO2. Yes, this is type 2 respiratory failure. It is also called as hypercapnic respiratory failure. Normal PCO2 and high PCO2. So normal PO2 is not a respiratory failure, and low PO2 and normal PCO2 is again not a type 2 respiratory failure. So option number B, which is low PO2 and high PCO2, is a type 2 respiratory failure. And if we talk about the examples, then one example is COPD, one is OHSS, and asthma can be there. So these are the examples of type 2 respiratory failure. A patient has got a blunt chest trauma present to casualty with BP of 80 by 50. PR is 100 per minute and engorged neck veins are present. What is the probable diagnosis? So we know that here hypotension is given, engorged neck vein is given, and tachycardia is given. And it occur after the blunt chest trauma. So after the blunt chest trauma, most common pneumothorax can be there, cardiac tamponade can be there. So here, as BP is low, hypotension is there, and the engorged neck vein is present. So these are the feature of the cardiac tamponade. If we talk about the cardiac tamponade, then backstride is present, which is hypotension, muffled heart sound, and engorged neck veins. So except this triad, plus tachycardia is also present. So here hypotension is given, engorged neck pain is given, and heart rate is also increased. So tachycardia is also present. So answer here will be option number C, cardiac tamponade. A patient has IDDM, insulin-dependent diabetes mellitus, diagnosed at the age of 15 years. Which of the following is the most reliable indicator for the diabetic nephropathy? So they are asking about the complication of the diabetes, which is a diabetic nephropathy, and the reliable indicator for diabetic nephropathy is when there is a protein greater than 550 mg per day is present in the urine for the 3 consecutive days. Minimum it should be 3 consecutive days. So here answer will be option number B, greater than 550 mg per day. Which of the following is the drug of choice for the paroxysmal supraventricular tachycardia or the PSVT? So this is again a direct question. We know that the for PSVT most commonly used drug is adenosine. So adenosine is given when PSVT is the patient of the PSVT is stable. But if the patient is non-stable, then shock is given. Okay. And if we talk about the prophylaxis for the PSVT, then verapamil is given for prophylaxis. And starting a treatment of the PSVT, firstly we have to give the vagal maneuver or the carotid massage. Then after that we have to come on the adenosine. Next question is chelation therapy is used for which anemia? So chelation therapy is used for the thalassemia because in thalassemia iron overload is present for which chelation of the iron which is desferoxamine is given. So answer here will be chelation therapy is used for the anemia. Next question is ulcerative colitis starts in. So option number A is the descending colon. This is wrong. Transverse colon, again this is not true. Cecum, no. Rectum, this is true. So ulcerative colitis mainly start from the rectum, then it can spread backward to the colon and sometime ileum also, so backward. Next question is normal range of serum potassium in milliequivalent per liter. So this is again a direct question. It is 3.5 to 5.5. Less than 3.5 is hypokalemia and greater than 5.5 is hyperkalemia. So next question is what is Kazan's disease? So we know that Kazan's disease occur due to the formation of the nitrogen bubble, and it is a kind of decompression sickness which occur in the deep sea divers when they come again to the surface after diving. So there is a change in the pressure which will lead to the formation of the nitrogen gas bubbles which lead to the embolism. So Kazan's disease is basically a gas. So answer will be gas embolism. Kazan disease is a gas embolism seen in the seen in deep sea divers, and it occurs due to the formation of N2 bubbles due to pressure difference. Now next question is volume determination preload is. So what is preload? It is a load which is present in the heart before it is performing the contraction. So it is end diastolic volume of the ventricles. So answer will be option number A. It is a end diastolic volume of the ventricle, and the volume which is left after the systole is the end systolic volume. Best test for GFR is, so we know that best test for GFR is inulin,
but most commonly used is creatinine. So, among the following, best test is inulin, but most commonly used is creatinine. pH is mainly used for the renal plasma flow. And value of GFR is 125 ml per minute or 180 liters per day, which is very close to the insulin. So, insulin is best for the GFR. Isoosmolar, isomolar urine is seen in. So, first option is ATN. Yes, isoosmolar urine is seen in ATN. Diabetes insipidus, no. Hypoosmolar urine will be there due to polydipsia, polyuria. Severe dehydration will have the hyperosmolar urine. And polycystic kidney disease also have the hyperosmolar urine. So this is also not true. So answer here will be ATN, in which isomolar urine will be there. Acute tubular. So next question is, episodic muscular weakness is seen in all except. First option is hyperkalemia. This is true. Whether it is hyperkalemia or hypokalemia, both can lead to the muscular weakness. Myasthenia gravis, of course, this is also true. Hyperphosphatemia, no. Hyperphosphatemia do not show muscular weakness. Hypophosphatemia can lead to the muscular weakness, but not hyperphosphatemia. So this is not true. And Lambert-Eaton syndrome, which is similar to the myasthenia gravis, it is again a cause of the muscular weakness. So this is also true. So answer here will be option number C. Hyperphosphatemia do not present with the episodic muscular weakness. Next question is, drug of choice to control supraventricular tachycardia. So this is a direct question we have already discussed in the previous papers, that drug of choice for the PSVT is adenosine. If we talk about the verapamil, then it is used for the prophylaxis of PSVT, and it is a drug of choice for PSVT. And if we talk about the PSVT, then firstly we have to start with the vagal maneuvers or the carotid massage. Then we have to go for the medical management. If the patient become unstable, then we have to go for the shock. Next question is, most common type of hepatitis responsible for epidemics in India. So we know that hepatitis B is common in India, but they are asking about the epidemics. So epidemics, most common cause of epidemics in India is hepatitis E. So what is epidemics? Epidemics mean they are asking about the acute hepatitis. So most common cause of acute hepatitis is also hepatitis E in India, and second most common is hepatitis A. If we talk about hepatitis B and C, and then they are cause of the chronic hepatitis. So answer here will be hepatitis E. Treatment of 42 years old obese man with blood glucose 450, urine albumin 2 plus, and sugar 4 plus, ketone 1 plus. So we know in the given option, the given question, blood glucose is 450. It means diabetes mellitus is there, and ketone is also present. So ketoacidosis is also there, and we know that whenever there is a ketoacidosis or ketonuria, then generally first treatment will be insulin. So answer here will be insulin. So first treatment in the ketoacidosis or ketonuria, whenever there it is present, then answer will be insulin. Then after that we will go for the the test for the electrolytes to see the levels of potassium. If the potassium levels are low, then we have to give KCl also. Next question is, Rose questionnaire is used for. So what is Rose questionnaire? Rose questionnaire is mainly used for the angina assessment. Then if we talk about the alcohol addiction, then it is Cage questionnaire. So Rose questionnaire is mainly related with the anginal pain for epidemiological field surveys, and Cage is for the cut, annoy, guilt, eye. The next question is damage to superior branch of middle cerebral artery results in. So, superior branch of middle cerebral artery mainly supplies to the Broca's areas. So, Broca's aphasia will be there because damage to superior branch of middle cerebral artery is there. So, it will lead to Broca's area damage leading to the Broca's aphasia. And Broca's aphasia is also called as the motor aphasia. So, answer here will be motor aphasia. If we talk about the sensory aphasia, which occurs due to the damage to the Wernicke's area, then it occurs due to the inferior branch of the middle cerebral artery, not the superior branch. So sensory or the Wernicke's aphasia, it occurs due to the inferior branch of the middle cerebral artery.